you're experiencing thumb pain, here's some techniques you can do to try to reduce your pain and improve the strength in your hand. So we're first going to start off with this sponge. Now this sponge is a graded sponge. There's different colors which indicate the different level of resistance. I'll put a link in the description for some of these. If you don't have one of these sponges, you can just use a washcloth and roll that up, or a small towel. I've had patients use all sorts of things for this, those small squishy balls, just kind of whatever you have. So what we're talking about is that thumb pain around the base of the thumb here. Maybe it's just non-specific. You've not been diagnosed with any type of specific condition of the tendons or anything. It's just general thumb pain. So what we're going to work on is this movement right here. So my thumb is kind of coming in to my fingers here. And what we're going to do is just kind of press down, squeezing into that. I'm just pushing in and relax. And I'm pushing in and relaxing. Not super hard there. I'm not putting a lot of resistance into there, a lot of force into that, just kind of back and forth. Repeat that for 2 to 3 sets of 10 to 20 repetitions. If the repetition range is too much and it's aggravating it, then just work on squeezing that down and just statically holding that. Just work on just holding it in that position. Maybe you hold that for 10 to 15 seconds and you only do 3 to 5 repetitions with that. Either way, just don't aggravate or over-irritate your symptoms that you're having. Our next movement using that same sponge, we're going to work on this pinch pattern here. So you're going to take it on the top, squeeze your thumb down or press your thumb down, and you're going to hold that for 1 to 2 seconds and relax, come back out, push that down again, hold for 1 to 2 seconds and relax. If that aggravates going through those repetitions, just like the previous exercise, just work on pushing that down, statically holding that maybe for 10 to 20 seconds and relaxing, and only doing that for maybe 3 to 5 repetitions. Next, we're going to take one of these exercise bands. You can use just a rubber band if you don't have an exercise band, even one of those bands or that goes in someone's hair. You can use that as well. So what you're going to do is just work on bringing the fingers apart like that, pulling the thumb back. If that's too painful, then just work on pulling it back. Even if the band doesn't move, you don't have to bring it all the way back. Just that tension against the band there will activate those muscles, and hold that and then just relax. Go back out again, hold that for a few seconds and then relax. Repeat that for 2 to 3 sets of 10 to 12 repetitions. Now taking that same band, what you're going to do is pull it on the back of the thumb here, pull back the thumb, and you're going to work on trying to bring the thumb down. So I'm bringing my thumb down against that band. I'm going to hold that for a count of maybe 2 seconds and relax. Come back down again, hold that for around 2 seconds and relax. Repeat that for 2 to 3 sets of 10 to 12 repetitions. Our last exercise, we're going to use one of these dumbbells. We're going to work on what's known as radial deviation. So we're going to go down and you're kind of bending your wrist so that the dumbbell's coming away from your shoulder, and then pull it back, back down, and then back. For someone that's having a really flared up episode of a tendinopathy here on the back side of the thumb, this may be too difficult. You might not be able to do it, and that's okay. But if you can, you're going to go back and forth for around 2 to 3 sets of 10 to 12 repetitions. Lastly, something that works really well is some sort of bracing or splint for the thumb. Those do really well. You can buy those prefabricated, or a hand therapist or someone can make you a splint. But if you don't have one of those and you're just looking for additional support, you can take some of this tape, elastic tape that sticks back to itself, Coban, Coflex, whatever. I cut a hole in the center of this. If you can see, I cut a hole in it, so there's a little piece, an overhang there. And what I'm going to do is kind of go around my wrist with this, and then I'm going to go around my thumb. I'm wrapping around my thumb and then around my wrist. Almost kind of looks like I'm making a boxer's glove that they would, or how you would wrap the wrist, maybe a boxer before they're boxing. So you're just going to put that around, just creating that support around the base of the thumb. Don't get this too tight so you cut off circulation, but that's something that you can put on throughout the day, and I can still use my fingers, can still move my thumb, just not as much, but it's definitely giving me some support there, so I like that technique as well. You also can use a kinesiology tape, and so there's all sorts of kinesiology tapes out there. I personally like the Rock Tape brand. There's all different kinds again, but Rock Tape for me works really well. So if you'll notice, I cut a slit in this as well, just like the previous piece there. Now there's a lot of different opinion as far as how much tension and all those kind of things do you put on the, as far as the tape and all the position the hand needs to be in or the wrist needs to be in. It doesn't really matter to me. Honestly, it's whatever feels the best. So what you're going to do is I'm going to put this tape down on the thumb here into my palm. So I'm putting it around here to stabilize it, and then I'm going to pull this back down my forearm. Usually I have the patient maybe go in a little bit of neutral there. Maybe I go into a little bit of radial deviation, and I would normally cut a little longer piece, but just for the purpose of the video, kind of just doing it this way. And then I'm going to rub that down. That gives nice support that you can see right here on the back side of the thumb, especially for those two tendons and their corresponding muscles that can become inflamed right here in that tendon sheath that can become inflamed. That works really well. You can put an additional piece kind of wrapping it around here if you'd like. If this starts to come up, that works as well. And you can just wear that throughout the day. I usually have my patients wear that for several hours. Sometimes I wear it for several days, as long as the adhesive doesn't aggravate their skin. So that's just a couple of techniques using tape. But again, you can also buy a pre-fabricated splint as well. Thank you so much for watching. I hope this helps with your thumb pain. Be sure to hit that subscribe button so you can stay up to date on all my content.